Hi guys, how we doing tonight? I'm Greg from the YouTube channel Growing Older Gratefully. Um, Before I get started telling you how I'm feeling today is day 4 of my journey from the day before post-op on a left hip replacement surgery to the surgery till now a couple of days later. I just want to touch on a couple of things first. Terry R., I want to thank you for your comment that you had made in yesterday's post. Terry's comment was in regard to what I was talking about, not hesitating. Let's make it a move if you have some things going on medically. Definitely, get to see medical professions. I will say another thing. My wife and I were big internet and YouTube people. If there's some things you want to know, there's so many different there's so many different sites out there and so forth that you can get some good information and hopefully you piece it all together. And like I said, definitely don't be like me. That's going to be a theme moving forward. That what had happened to me and now what seems to be the aftermath of it is don't make the mistake of postponing. You're just making your life and your health more miserable than it has to be. Another thing I want to allude to is I want to give a shout out to my main caretaker. My wife has been wonderful. I will say this, either for viewers who have either had somebody take care of them or they had taken care of somebody, whether it's your parents, it's your wife, husband, kids. Let's be honest, folks, they're invaluable. My wife, since actually the morning of surgery itself, being there at the clinic with me, and of course thereafter, it's just been, God sent. I also want to give a shout out to my brother-in-law, Jerry. Jerry and his wife, Karen, they live with us. And from the time I got home, my wife had to go for a little bit. She was out of the house for a while, and she had left him with the job of, hey, every hour Greg needs to get up, get moving, and would you, take over that position and just to make sure, and that's what he did. And I try not to bug him, but every time I turn around, he's right there. Hey, you need something, you want something, what can I do for you? So I just want to give a shout out, like I said, to my loving wife and my caring brother-in-law, Jerry. Now let's get to how I'm feeling today. I will say, and it's about, I think it's about 7:15 Central Time here in Fort Walton Beach, Florida. I will say this, I slept better last night than I did the night before. I was telling you yesterday, it's been an adjustment for somebody who's, I wouldn't say a violent sleeper. Like I said, I'd use it more like a fish out of water. I like to flip around and find my 1 of 10 spots that I like to get comfortable at least for 10, 15, 20 minutes, half hour, and then, of course, go on to the next one. So that has been a big adjustment, trying to just lie on my back. I seem to have a very restful sleep last night, so I am grateful for that. Very grateful. As far as my pain level, I'm not in a lot of great pain. There is a lot of discomfort. I have been up. I have been moving. I am doing, which they give you like the bare minimum exercises to get you going. I have done those today. I will say they're painful, but they're not excruciating. As far as when I was talking about like with meds, I'm taking my Tylenol, I'm taking my ibuprofen, my antibiotics, I'm taking a nausea pill, I'm taking an aspirin. But I do feel fortunate just in my case. Now, when I had mentioned now this is another day, I thought if I needed a hard medication, I would take one of my oxycodones. That hasn't been the case. I felt no need to do it, and quite honestly, I feel since that is the case and I don't feel I need, I'm not going to take it. One thing I will say there, and I'm not harping and chirping on anybody to stay away from that, it's just in my own personal belief, I just feel like, I think honestly, what's helping my recovery these couple days into it is the fact that I don't feel groggy. I'm not in bed sleeping all the time. Like I said, I'm up, I'm on the computer, I'm walking. Relatively speaking, I got a clear head, or as clear as I guess it's going to be naturally, normally. So I feel pretty good about that. But like I said, folks, anybody who's going through things, and let me know in comments how things had worked out for you. But don't be afraid. To first and foremost, if you trust your doctor, obviously whatever he or she says, you abide by it. That's where that trust comes in. So as far as that, like I said, today feeling very well. I think, and like I said, it's after 7 o'clock Central Time. I will say this: the fact that I'm been kind of cooped up on my second floor. I am getting a little stir crazy. So this is another day and a day further of that craziness kind of going in. Today I found myself really wanting to climb down those stairs. I stopped myself. I refused to do that. I think being Sunday night, what I'm going to do is my plan is going to be I'm going to go one more day. So I'm going to stay up, cooped up all day tomorrow on Monday. I definitely have to get out Tuesday because Tuesday is going to be my first physical therapy session. So that I definitely, and that's, it's going to be a short 10-minute drive. It's actually in the same building where my orthopedic surgeon is, where the surgical center was. That's just on a different floor, but it's all in the same building. It's about 10 minutes away. One thing I did want to add, I want to keep this a little bit shorter than, say, yesterday's video. But one thing I do want to add is my wife and I, we have started our Facebook page, Growing Older Gratefully. And we love any and all viewers of ours. Please go to that if you'd like to join. We'd love to have you on there. Like I said, and join the community of our Growing Older Gratefully. Another thing I'd like to add is already as we're getting some people joining at Facebook, there's some young and old. Now I want to say this, that our channel itself, Growing Older Gratefully, it's not meant to be, for lack of a better word, it's not meant to be a geriatric channel. Quite frankly, if you really think about Growing Old Gratefully, that starts from the day from you being born. So what happens is a lot of times you may have some younger folks, and we've got some younger folks on there. They're not realizing, well, I'm in my 20s and this, that, and the other thing, but they also forget they're growing older and things are changing. There's some people on there recently got married, some serious life changes, got married, they're having babies. So unbeknownst, let's say to them, they are growing older. That's inevitable. And they're having to deal with what we all do, which is, guess what? Some life changes thrown at you. But like I said, I just wanted to touch base tonight to say that I'm feeling very good. I'd love, like I said, feel free, leave me some comments, because I love to hear, everyone out there, their life experiences. Maybe you got some good, bad, some indifferent of what had happened to you or a loved one of yours. Let us know. Like I said, definitely want you to comment. Would love you to join our Facebook, Growing Older Gratefully. And like I said, with that, I think what I'm going to do is cut tonight short. I'm probably gonna end up trying to stay up a little bit, because last night was a good omen where I slept pretty well, and I think part of that was that I wasn't trying to lay around too much. I am doing, like I said, I'm switching off. I'm doing my icing. I'm icing my area very well. So I think what I'm going to try to do is maybe stay up a little bit, maybe try to catch one of the ball games, and hopefully get a good night's sleep. Anywho, you guys have a great rest of the night, and I will talk at you tomorrow. Thank you.